Thank you so much for joining us today as we talk about more exciting programs at Cuyahoga Community College. I'm joined today by Marquee Rockamore. She's the Director of Health Industry Solutions at Cuyahoga Community College. She's here to chat with us today about the current healthcare climate. In addition, she's here to talk to us about a program called Community Health Worker. So Marquita, thank you so much for being here today.
Thank you for having me.
Yeah, it's great to have you and have this discussion. I know I'm going to learn a lot today, and so are our viewers. If you could give us a brief description about yourself and the work you do at the college.
My name is Marquee Rockamore, and I'm the Director of Health Industry Solutions. We are a department in corporate college under the Workforce Community and Economic Development Division of Cuyahoga Community College. Our team offers short-term fast-track training in the way of STNA, which is State Tested Nursing Assistant, Community Health Worker training. We offer Patient Access Specialist, Comprehensive Professional Medical Coding, and we also offer continuing education training for dental assistants, massage therapists, and customizable human patient simulation scenarios for healthcare teams through our human patient simulation labs.
There's so much that falls under that. So we're going to have to do a million more of these videos so we can hash all those out. It's really great though that you're offering these programs to the community. There's so much in the area of health, the health industry in general. I want to jump into kind of like a hot topic right now too, before we jump in the full program of community health worker, and that's some interesting stuff regarding COVID-19. And one of the things, I was in a meeting with you, you recently had mentioned, Ohio's need for contact tracing. So I guess, my question is, what is that and why is it important?
Contact tracing is a specialized skill and can be an effective public health intervention. And it's been used for many years, and it involves calling close contacts of the confirmed COVID-19 patients, providing them with information about the disease, and encouraging them to self-quarantine for a minimum of 14 days to potentially avoid affecting others. A contact tracer will then follow up with them to provide support and encourage them to get testing if advised.
So I can see why this would be important, and not just during the pandemic like we currently have, but also during other outbreaks of other issues, even like a really bad flu season or something like that, where we really would need to track, where this is going and who it's affecting the population. So when we think about contact tracing though, who is responsible for that, and what type of training would be out there for an individual that's might be interested in it or has already kind of found themselves going that direction?
Well, that would be your local public health department. They're responsible for contact tracing, and community health workers are well positioned for this job. The training that certified community health workers receive prepares them to build rapport with cases who tested positive for COVID, prepares them to provide the case, which is the COVID positive person, provide them with education and information to support them and understand their risks. The training that certified community health workers receive prepares them to build rapport with their cases, which is the person who tested positive for COVID-19. It provides their case, and they can provide their case and their contacts with education and information to support and understand the risk and what to do to separate themselves from others so that they are not exposed. The training also prepares them to conduct what we call case investigation, where you work with COVID-confirmed patients to recall who they've had contact with so that you stop the transmission within our communities.
Wow, that sounds like such an important piece of the health system, and maybe something that's even overlooked at times. And you were talking about the community health worker as being someone who would be positioned well for that, that job or, that responsibility. So could you talk a little bit more about a community health worker? It sounds like a really broad term. I imagine there's a lot of different things that fall under that umbrella.
You were so correct. The work of a community health worker can be found under many titles, such as a health coach, a home visitor, maternal and infant health outreach specialist, a neighborhood advisor, a patient navigator, a peer counselor or educator, community resource navigator, or even a community care coach. They're advocates, they're educators, they're promoters, they are community health workers. So they are uniquely, a community health worker basically is a person who is from the community or uniquely connected to the community, and they work in a number of ways to improve the overall health of the community.
And again, such an important thing for our community to have and to have access to is those individuals that can, be informative and advocates and so many different things. So is there a high demand for this career right now?
Most definitely. Even before the pandemic, the need for community health workers was on the rise. Community health workers are hired by managed care organizations, hospitals, community organizations, federally qualified health centers, community centers, and even health departments. Now, with the pandemic and all else that we have going on, and as you said, the impending flu season, there's just going to be a great need for community health workers. To do contact tracing takes time and detail and documentation and a lot of follow-up.
Yeah. So, you mentioned just now, like with contact tracing, detailed documentation, follow up, but you also listed all these, variety of areas that a community health worker would serve. What does a day-to-day look like on the job for a community health worker? Is it the same? Is there a lot of different things that you might find yourself doing?
Well, it depends on the environment. In a hospital, community health workers work to reduce emergency room utilization and hospital readmissions. They look to increase the patient's ability to self-manage and share decision-making with their providers and provide resources to enhance the patient's overall well-being or increase patient satisfaction. And that helps to reduce healthcare costs. One particular example of a day in the life of a community health worker was when one of our students was doing her practical hours. And she was assigned to one of the area hospitals to work on a study. Two wonderful physicians had put together this project around hypertension, and they were trying to get people in the study. They had 15 people. When they enlisted the help of two community health worker students, one of them being our community health worker student, that study went from 15 to over 1,000 individuals.
Oh my goodness.
Yes, the report that the community health workers were able to provide, the follow through, allowed that not only the study to grow, but for people to have their numbers improve. And the difference was not just that connection, but the way the community health workers followed up to help them understand how to use their patient portal, understand what their numbers meant. It was just an overall health literacy type educational project, and patients not only understood, but they saw improvement in their numbers.
Wow. And what a positive impact they had on that study, but also on the individuals that were participating. That's
Yeah.
so great.
But if we were in the community, it would look a little different. They would participate in, a community health worker might spend the day participating in the agency recruitment activities to increase enrollment or participation in their program. They would coordinate or host or implement community events or group experiences like health fairs, community baby showers, resource fairs, picnics, or education sessions around the concerns and impact of the neighborhoods they serve. They could also deliver educational presentations such as safe sleep, lead prevention, knowledge about abatement resources for lead or Medicare resources to seniors. If they were in the community, they would attend meetings around the agency and community collaboration. But in the home, they could visit seniors to assist them with applying for benefits. They might support someone with hypertension or diabetes on how to follow through on their healthcare plan, or just connect families as appropriate to resources to meet their individual needs.
Wow. That's like such a broad scope. And I love the idea of a community baby shower. I think just anything that brings the community together, the joy of new life. And then, you have people getting together for that. That sounds like a fun thing to coordinate and try to get together.
I've known agencies that have community health workers that have bowling events. And at that event, they shared information about infant mortality and other issues that were impacting that event. But it's community health workers do things in a way that brings the community together, again, to not only connect them around issues that may be happening, but to support them and around improving their situations.
Yeah, sounds like there's a lot of relationship building going on during that time too. Someone might be really excited about the idea of being able to serve in so many capacities, serve their community. What does the training look like to get into this field? What's the curriculum look like if someone's wanting to enter that? How long is it?
Our community health worker program is 26 weeks in length. That includes 100 hours of didactic or classroom hours and 130 practical application hours, where you are in the community working with organizations and agencies in which Tri-C has agreements to provide the community with services and do practical application of the skills learned in the classroom. Our
And
program
that's
is approved
huge,
by the Ohio
right?
Board of Nursing. I'm sorry, I jumped the gun on the
Oh,
question.
no worries. I was gonna say that's huge, right? To have those practical hours in the field. I mean, that's what's the key to being successful when you're going into a career. You're actually shadowing people, working under them, doing
Mhm.
those things that are really important to learning the job.
It is key. And our program is approved by the Ohio Board of Nursing. And when a person is done with their 130 practical hours and their 100 classroom hours, they'll be able to submit to the Ohio Board of Nursing to become a certified community health worker.
Wow. That's so great. And what a service to the community that someone could provide by entering that field and, making change in other people's lives for good by being that advocate. Yeah, wow. So, Marquita, thank you so much for joining me today to chat about this. I've learned a lot. I know I have. So, I'm sure others will too.
Thank you for having me again. And I'm just so excited to talk about the work that a community health worker does and the value that they provide to the community.
Yeah, it's awesome. So you have to join me again for another chat about some of our other programs that you mentioned earlier, because there were so many that you listed that I think are really important. And if anybody tuning in today would like more information about the Community Health Worker Program or anything offered under the health industry, please visit the link in the description. And as always, have a great day and stay safe.